Good evening, everyone. Myself, Dr. Hafsa Mohammadani. I will be dealing with general medicine topics as previous classes. Today, we are dealing with hematology and endocrinology. Let's start. I hope so. The previous class, I have taught you some techniques to deal with the longer questions and to not to make mistakes with the simpler questions. So, first, let us go to the first question. The deficiency of coagulation factor 9 is associated with. Here, I just put this question to make you understand that the cascade of coagulation, the factors and the elements and then everything from this chapter is very important. They have asked you, I think so, they have asked more than 100 questions jumbled up in many forms from this section itself. This is the main section they deal with, making the questions from hematology. So be sure that you have the correct table that gets you the full points on coagulation, all the factors, which all deficiencies causes which all diseases. So here the answer is hemophilia B, but I want you to look at the four options: hemophilia A, B, Hinox-choline purpura, and sickle cell anemia. Four of them are equally important. So your theory part should be very thorough with four of the part. So here I have taken a box from Davidson. It deals with the coagulation factors and the conditions that causes which deficiency. So please note this box from a table from Davidson and make thorough with your theory part. So next one, to assure the surgical hemostasis, the blood products administered pre-operatively. So you have to focus on the word pre-operative to patient with classic hemophilia. These are all repeated questions that are asked in your exam. So hemophilia is one of the important portion that they jumble up the questions in many forms and they ask. So here, let us look into the explanation. Then you understand it very clearly. Factor 8 concentrates are freeze and dried and stable at 4 degrees Celsius. It is given as IV. So they might ask you, what is the route of administration? These factors. Treatment of hemophilia is by infusion of factor 9 concentrate. So the answer is clear. It is the 9 concentrate. Now you can also, I just put up extra points to make you understand that von Willebrand disease also can be asked. So von Willebrand disease can be successfully treated with desmopressin, which raises the von Willebrand factor level, and with factor 8 concentrate. So make sure that all the factors, even von Willebrand is one of the main area of setting the questions. So next, let us go into a clinical scenario. A child underwent a tonsillectomy at 6 years of age with no complication. So let us make this part into first part, that tonsillectomy at 6 years. He underwent a pre-operative screening for bleeding at the age of 12 years before an elective laparotomy. So this is another case scenario for the same child. After 6 years, he is going for another operation and he has done a pre-operative screening. Then he has found to have the PT, a prolonged PT, but normal prothrombin time. Partial thromboplastin time is raised, but the normal prothrombin time. There was no family history of bleeding. This is very specific. There is no family history of bleeding. The patient is likely to have acute vitamin K deficiency. So here the question is a bit twisting, a bit confusing. The patient, so you have to understand that this patient has not had any complication in the first surgery. So what does that indicate? And the child is going for another elective surgery, and the findings, you have to specifically note that partial thromboplastin time is raised and with normal prothrombin time. So let us go into the explanation and I will get back to this slide. So here PTT is prolonged in which all factors deficiency, and PT is prolonged in which all deficiency. If just imagine if you are not very sure with the exact concept and exact answer, it will be very easy that you go with the wrong answer. So such questions, answering such questions should be very careful. For that, I'm saying that this area, like the bleeding time, the clotting time, the prothrombin time, all this PTTD, APTT, all these findings should be very sure with your theory. So isolated PTT suggests that a defect in intrinsic pathway and pathways, extrinsic and intrinsic pathways are very important, and leaves the possibility of either factor 12 deficiency or factor 8 deficiency. So it goes 8 goes with hemophilia. So absence of clinical bleeding even after the major surgery like tonsillectomy suggests a classical deficiency of 12. So this is the very twisting question, very complicated question that makes you very confused. So that you have to be very sure that prior major surgery of tonsillectomy has not caused any complication. So what will be the answer? It could will it go with 8 or will it go with 12? So here the answer will go with factor 12 deficiency. So next, here I just put this very small question, very simple question, just to make you understand von Willebrand disease is an important part in your theory part. Never skip this part. So von Willebrand disease, as you know, it is an autosomal dominant condition. Here, I just put another point also to make you understand that they might ask you the transmission of hemophilia. Also. So hemophilia is transmitted X-linked recessive, but von Willebrand is autosomal dominant. Now let us go into conditions called leukemias. Leukemias are very important. Be sure with CML, CLL, ALL, and AML. Your theory part with these four conditions should be very sure. And I'll get you a box from Davidson that is also very easily absorbable table. So this is just a question. I just took a random question to make you understand that leukemia is an important part. The condition which patient presents with normal leukocytic count or less than the normal and shows WBC in the peripheral blood. So what is the condition? So I just put here the question to make you understand. This box is very important. It shows you the different condition diseases and abnormalities in the peripheral blood. From this box, you can easily answer such questions. So I put another question here. Macrocytic anemia is due to deficiency of what? Why did I put this question? It is a very simple question, but the morphology of hemoglobin is very important. They might ask you microcytic, hypochromic, normochromic, macrocytic. So they can come. There are diseases with normocytic hypochromic, normocytic normochromic. So such patterns will be repeated. Such patterns will be jumbled up in a way to confuse you also. This can be asked in clinical scenarios also. They might say your patient came with tiredness, weakness and all. When they send for peripheral smear, they show such findings. So you have to be sure. So macrocytic, megaloblastic anemia that goes with vitamin B12 deficiency. Now, I just put frequent repeated questions from this area just to make you understand that this area is very important. They jumble up the questions and they can frequently ask you. So, clinical hemophilia is characterized by BT, CT, PT, and PTT. So, where is clinical from this? If you don't know the exact answer, just look into the options. Just look into the options and you may understand it's very confusing. All look same and what could be the right answer. So if you're not very thorough with the theory part, very accurate about all these factors, very specific about all these factors, the answers can go wrong. So what could be the answer? Here Sorry, we had some technical issues. I hope so. You all are here. Let's go with other slides. Let me just skip the slides, please. We have dealt with all these questions. Yeah. So we are here regarding leukemias, which are the following correct. I just want to make you sure that leukemias are very important section. Leukemias should not be skipped. Leukemia should be in your notebook. Your note should be very thorough with leukemias, the findings, the chromosomes. They might ask you the specific chromosomes and specific findings. Specific investigations are also very important for each leukemia. The investigations are different. So here bleeding tendency is AML is the correct answer. And just I put here the question to make you understand that leukemia is an important part. Okay, the most important aspect in treating DIC is to that I just put these questions to make you understand. These sections are very important. Like I just put single questions, repeated questions. When I went through the paper, repeated questions are asked from these areas. So coagulation, I said the coagulation cascade, the pathway, and the defects in the pathway are also very important. So the most important aspect in treating DIC is achieving normal levels of fibrinogen. So DIC is an important topic. Please make sure that your theory part of DIC is very clear. Okay, I just put another slide from Davidson to make you sure the courses of DIC. What are the courses of DIC? Okay, so please go through Davidson and make sure that your courses of DIC and the treatment protocol, the conditions are very clear with your theory part. So next, all of the following components or qualities of stored whole blood tend to decrease over time, except. So here, this question is put up to make you understand the blood transfusion. The section of blood transfusion is very important. The preservatives of blood transfusion, the components of blood transfusion, in which conditions which blood is given, what is the properties of these components, what are the storage time, what is the storing temperature of these blood components. So I just put this question to make you understand that the topic blood transfusion is very important. So here the potassium concentration is the answer. So going into the explanation, the components which are destroyed quickly from stored blood are WBC, clotting factors and platelet. Stored blood is rich in potassium, therefore massive transfusion can lead to hyperkalemia. Okay. So which of the following is not seen in hemoglobin electrophoresis in sickle cell anemia? So another section is sickle cell anemia. Sickle cell anemia, the theory part, the findings, the investigations, the treatment protocol, the chromosomes, which chromosomes are involved, the investigation part, everything is important in sickle cell anemia. And sickle cell anemia, the another organ like in sickle cell anemia, which other organs are involved? Such questions can be also asked. So here the answer is HbA. So here is the just small theory part of sickle cell anemia. So sickle cell anemia should be very thorough. Here in today's class, I just took a few questions from each sections and I just put here to make you understand that these sections are very important. You have to not skip these sections, but never ever confine your practicing of questions into these areas, but your theory part should never skip these areas. You have to elaborate on this. You have to learn more on this. For that, I have just put single questions from each sections to make you understand that these sections are very important. Some of the more sections are also there, but this section seems a bit more like important that they are repeatedly asked. So never skip these areas. So sickle cell anemia is one among them. So next we go for raised serum alkaline phosphatase. This is also a very important section. And this question I just put to make you understand. In previous sections also I have put except questions to not make confusions while practicing the questions. Except questions are frequently asked. So in the if you have attended the previous classes, you will understand that why we should know the right answers, then only we can skip the except answers. If we are very sure with the right answers, then only we can go with we can easily identify which is the wrong answers. Otherwise, we might get confused the whole answers look a bit same. So here the answer is multiple myeloma, but you have to be very sure that the right answers are very thorough with your side. Then only we easily skip the wrong answer. So next one here, I just put a slide from Davidson to make you understand which conditions there is elevated alkaline phosphatase levels. Make thorough these sections, and so except questions can come in jumbled up way from this section. So next, let us go into a clinical scenario. I hope so you will also read with me. A 20-year-old female came to the medical OPD with severe pain and redness over the dorsum of the foot. Past history of severe abdomen pain episodes were present. Peripheral smear showed anemia with presence of poikilocytes, likely diagnosis. Let us go into the explanation, then let us come back to these options. So when we go into the clinical explanation, you just look at this. These are the features of sickle cell anemia. So here repeated questions come from sickle cell anemia. So here the question fits into these findings. So just look here, the bone pain and hands and feet due to plugging of vessel. That vasculitis happens in sickle cell anemia. Then you go for abdominal enlargement and abdominal pain, then osteomyelitis, then arthropathy, then blood film shows poikilocytes. So this all the entire question fits into the clinical features of sickle cell anemia. So if you're not very thorough with the clinical findings of this question, then what happens? We are very much confused in the examination hall that which condition does it belongs to, because all conditions have got their own specificity. So here I want you to look into the four options, and I want you to make sure that the whole four options are very thorough with your theory part, because they might ask you from all four sections, even G6PD deficiency, thalassemia, hemoglobin C disease, everything is very important. Make sure the whole part is very thorough with, then you answer exactly. So then we go with blood groupings. Blood groupings, again, blood groupings are very important. They might ask you in a very confused way, that they might give you the positive, negatives, RH positive, RH negatives, and all. Then you have to know the universal donor and universal recipient. That should be also not confused. So here a question is given: a AB negative girl should be given blood group. Which blood group can be given in case of non-availability of her blood? That is a very important word, non-availability of her blood. So we get confused. What can be given? Here comes the role of universal donors and universal recipients. So I think so from your theory part, you're very sure with the universal donors and universal recipients. So O negative is the universal donor. So O group is universal donor. In case RH factor is negative, O negative person can donate the blood. Now comes the Philadelphia chromosome. I just put these questions to make you understand the leukemia parts are very important. Here the question is except question. Here I just put the question just to make you understand that Philadelphia chromosome, it's an example of chromosomes from leukemia. There are different chromosomes in leukemias. They might ask you the translocation of different chromosome in Philadelphia, and here they have asked you the except questions. The theory part of Philadelphia chromosome from leukemia, they have given it very clearly in the theory part. So just go through the Philadelphia chromosome. Leukemia is one of the important section. Never skip leukemia. So Philadelphia chromosome is associated with CML. This is the first reproducible chromosome abnormality detected in human malignancy. Abnormality is generated by reciprocal translocation. So the word reciprocal is very important. Reciprocal translocation between chromosome 9 and 22. So they can ask you from any aspect, which disease does it belong to, what type of translocation is it, which chromosome are translocating. So these all questions comes from Philadelphia. So the part leukemia, as I said, leukemia with the chromosomes, with the clinical features, with their peripheral smear findings, everything is important. Next on a condition is polycythemia vera. Polycythemia vera is one of the conditions from the diseases, but I want you to get through all the diseases. Polycythemia vera, I just saw a single question from them and I just put it just to make you understand that these sections like bleeding disorders and all these disorders from hematology is very important. That make sure that the whole theory part is very clear, and you should know the whole right answers, then only you can go with the accept answers. So let us, that was the part with hematology. Hematology, as I said in the beginning, the coagulation factors, the cascade, the properties, the deficiencies, and the conditions are very important. In that named conditions like inox choline purpura, sickle cell anemia, hemophilia, that section is very important. Then leukemias, all the theory parts of leukemias are important. Please practice repeated questions from this area. First, you make your theory part sure. Make boxes to learn hematology. I think so. Tables will help you very nicely because it will give you the exact picture of the question and exact. You can shoot the answer very well from the table. If you have a thorough, very well made tables. So I want you to practice repeated questions from these sections and just make sure that you are not making silly mistakes from them. And you can also answer the long questions by making the practice of the method I said. You just read the question, just filter the words, just fix the diagnosis, and just filter the word and make sure that they're not asking about the except question or are they asking about the except question. So let us go into endocrinology. Learning endocrinology, you should never, the soul of endocrinology is diabetes mellitus and thyroid. Thyroid and diabetes mellitus, they can ask you many questions in many ways. In thyroid, even hypothyroidism, parahypothyroidism, hyperthyroidism, thyrotoxicosis, everything is important. They ask you different questions. In diabetes mellitus, the diabetes mellitus investigations, the type of medications given, the complications of the medications. They put clinical scenario questions from diabetes mellitus. How can you manage? What are the complication of immediate management? Everything is important. So let us deal with some questions from that section. So history of excessive thirst, hunger, micturition during night, and recent loosening of tooth or teeth usually indicate the patient is suffering from. So let us go into the explanation and come back. Diabetes mellitus is characterized by polyuria, polyphagia, and polypsia. So these conditions have fits into the question. Then you go with, if you are very thorough with the theory, then you just look into it. They have bone resorption, loosening of teeth. Then all other like ketoacidosis, cusumal breathing, circulatory shock, and everything comes in diabetes mellitus. So from from this explanation, you got that it can fix into diabetes mellitus. So you from here, what you understand, theory part of diabetes mellitus should be very clear. So here we go back, we got diabetes mellitus and the answer. So we shoot the answer diabetes mellitus with the explanation, with the thorough theory. Okay, then again, I have put repeated questions from diabetes just to make you understand that every aspect of diabetes is important. The diabetic patient in the waiting room develops giddiness, sweating, and confusion. He is suffering from. So, a diabetic patient. So, he is on medication. What can be the condition which will fit into that? We see repeated clinical scenario in a casualty that such patients come very rushing into the casualty with very a state of like we might feel the patient is comatose. When we look at the vitals, it may look fine, and we just call the patient. We just try to wake up the patient. The patient will be really unconscious. What is the first thing we have to look for? Here we have to look for hypoglycemia. Hypoglycemia is dangerous than hyperglycemia. So we go for hypoglycemia, and we have to look the blood glucose. Here we have to look the blood glucose, and we have to give the immediate correction. And you just see magical reactions from these patients. When you see the blood glucose is very low, and you just give the IV infusion like 25 dextrose and all, you give it, the patient goes very fine. The patient just says, what happened to me? Like such rapid changes can be seen, and such magical changes can be seen in diabetes mellitus with hypoglycemia. So first identification of hypoglycemia is very important. If it goes chronic, the the glucose supply may cut down, and all the problems happens as a sequelae. Then here, which is I just wanted you to know that the short acting, the medium acting, the long acting, the complications, the combinations, everything is important. So that's why I just put a question to make you understand that insulin is an important part. Here the answer is glargine. But you have to. This is a table from Davidson. This gives you. an explanation about which is the long-acting, short-acting insulins. So next, this is also taken from diabetes mellitus. This is acetone breath is a feature of. So from here, I want you to understand that there is a table in Davidson which gives you the breath, different breaths. So all are important. Musty breath is from hepatic coma, uremic breath is from renal disease, acetone breath is from diabetes mellitus, and alcoholic breath is from alcoholics. So this table is important and says that any questions can come from here, but acetone breath specifically comes from diabetes. We know that diabetic ketoacidosis happens in diabetes mellitus. So acetone breath happens in diabetes. Again, a patient, a 45-year-old female diabetic patient on insulin is brought to the hospital as a unconscious state. What is the first line of treatment? Look into the question. You should put IV insulin or you should put IV insulin with dextrose, IV dexamethasone injection, blood glucose test. When a patient comes suddenly into the casualty in an unconscious state, what is the first thing you have to do? You have to make sure whether the patient is unconscious, having the blood glucose went low. So first thing you have to do is you have to check the blood glucose level. That's why I explained in the previous section that such clinical scenarios can be set up because it's very frequently seen clinical scenario in a casualty. So first thing you are going to do is you are going to check the glucose level. So that is the answer for this. Okay. First, you have to fix the diagnosis. So the patient may get unconscious because of another reasons also. So first, you make sure that the patient is unconscious just because the patient is going for hypoglycemia. Okay, now let us read another scenario. It is a very jumbled up scenario, but the answer can be very simple when you just look into the exact answer case. So let us read together. A 70-year-old male is admitted to the hospital with a left hemiparesis and altered consciousness. He is on aspirin, atorvastatin, and glibenclamide, 15 mg daily. It's an OHA. So his wife says he has been unwell for a couple of days and he has found has been off food. He's not having food. He has, however, still been giving him all his medications. Which of the following test is going to be the most useful in finding an immediate reversible cause for his symptoms? So what is here? The patient is taking the medication, all medication, even the OHAs, even the medications for DM is taken, but the patient is being off food. So what can the patient go? The patient can go for hypoglycemia. There is no food to metabolize and the medication is given still. So what if even the patient can go for hyperglycemia or hypoglycemia? So what is the first thing you have to do? The first thing you have to do is look for the blood glucose level. Even the question is very elaborated. The patient is on aspirin, atorvastatin. Maybe the patient is on atorvastatin and aspirin because the patient is having left hemiparesis. So let us just go for the explanation. A patient is using aspirin, atorvastatin means the diagnostic case of ischemic stroke and on secondary prevention. Here it is sulfonylurea drug is given for diabetes mellitus. Hypoglycemia is most common cause of altered level of consciousness in any age. So there is reversible causes hypoglycemia. We have to check the blood glucose level. It can be that is the first answer you have to go. That because the patient is off the food and the patient is on the diabetes mellitus medication, the patient went into hypoglycemia. Even though the question is very large, but shooting the answer is very short because what is the immediate investigation that is reversible for the condition? So this is the reversible condition, right? So next one, let us read another question. A 41-year-old male presented to the emergency department with a 9-month history of cough, exertional dyspnea, nocturnal diaphoresis, and weight loss of 10 kg. Physical examination revealed a painless, massive, discrete, rubbery cervical, supraclavicular, and axillary lymphadenopathy because the patient is having a massive lymphadenopathy. Plain radiography of the chest showed bilateral hilar lymphadenopathy. Here also you get lymphadenopathy. Serum calcium level was elevated and serum parathyroid hormone is within the normal level. This is a very large question. That you might think that the question has gone into another areas of cough and dyspnea and all. This might go into CVS or RS, but looking into the answers, what can be the probable diagnosis of this condition is Hodgkin's lymphoma. Then you have to understand the findings of Hodgkin's lymphoma. Hodgkin's lymphoma present with painless rubbery lymphadenopathy. This finding is given in the question. So the painless rubbery lymphadenopathy is fitting into the diagnosis of Hodgkin lymphoma. Here, I put this question to make you understand that lymphomas are an important part of endocrinology. In non-Hodgkin's lymphoma, Hodgkin lymphoma, their treatment protocols that you have like codes with treating Hodgkin lymphoma. They have some protocols of treating Hodgkin lymphoma. The findings, the investigations, everything is important in lymphomas. They might ask you questions from non-Hodgkin's lymphoma also. Okay, then you go into the major section of thyroid. Thyroid is a massive section. They might jumble up the questions in any form and ask you from mostly, I think, so from more than hypothyroidism. They are very much interested in a parahypothyroidism, hyperparathyroidism. They frequently ask questions. So in Graves' disease, Graves' disease is one of the important sections from thyroid. And in Graves' disease, you know, exophthalmos is due to proliferation of tissue behind the eyeball. That is the answer. Okay, this is the example of Graves' disease. Graves' disease is distinguished clinically from other forms of hyperthyroidism. Understand, Graves' disease fall into hyperthyroidism by the presence of diffuse thyroid enlargement, ophthalmopathy, and pretibial myxedema. Okay. So next we go for hyperparathyroidism. Repeated questions are asked from hyperparathyroidism. I just put this question, simple question to make you understand hyperparathyroidism is very important. So increased level of serum calcium levels are seen. So then again, then another question with hypothyroidism, never skip hypothyroidism also, hyperparathyroidism. Hyperthyroidism is also important. At the same time, hypothyroidism is also important. You have to know the central and secondary, the primary and secondary hypothyroidism. So here the question is, when hypothyroidism is goes to by pituitary dysfunction. So when it goes to pituitary dysfunction, what it goes? It goes into central hypothyroidism. The following profile is present here: the no goiter, reduced TSH, and low T3 T4 level is seen. Okay, this will be the answer. So this is the explanation. So here I just put another slide to make you understand secondary hypothyroidism is also important. You just go through the theory part of secondary hypothyroidism also. Now, just another slide. Frequent questions. I can make many questions from the section of thyroid. Hyperparathyroidism, the biochemical marker. Here, the biochemical marker, hypercalcemia. Hypercalcemia can be seen in hyperparathyroidism. So you make sure that the theory part of hyperparathyroidism, parathyroidism, hyperthyroidism, hypothyroidism is very sure with your theory part. So next, which of the following factors determines whether a patient develops acromegaly and gigantism? This is very important. Acromegaly, the section, the clinical features, the investigation, the management of acromegaly is very important. So here the answer is age of onset of the tumor. That is the determining factor. But I just put this question to make you understand that the section acromegaly is important, or gigantism or acromegaly. The section is very important. Okay. Then these are the theory part of clinical features of acromegaly. There will be skin thickening, enlarged nose and tongue, macroglossia, carpal tunnel syndrome, large hands and feet, prognostic low or lower jaw, diabetic mellitus, then hypertension. Okay. This is the clinical features of acromegaly. This might be asked like from the section of acromegaly, but never shorten your theory part into this. Acromegaly is a vast section. You have to learn everything about acromegaly, the management, how it is managed, how is the finding, what is the investigation that you do to find out acromegaly, what are the pituitary findings. Everything is important in acromegaly. So here another named sections like Crohn's, Addison's, Addisonian diseases. These all diseases are very important. So make sure that your theory part is sure with Crohn's disease. There is excess of what? Aldosterone. This is a simple question I just put here to make you understand that these sections are important. Crohn's disease, Addison's disease, all these diseases are important. So another section, Addison's disease is due to chronic insufficiency of what? Chronic insufficiency of adrenal cortex. So Addison's disease, make sure the theory part of Addison's disease also very thorough with you. Chronic adrenal insufficiency is called Addison's disease. Okay. Here Addisonian crisis also very important. Here I just put another question. A patient complained of muscle cramp, loss of hair from lateral eyebrows, alopecia and constipation. His blood investigation most likely showed deficiency of what? So if you know the thyroid part very clearly, it's very simple question. The deficiency of TSH will be seen. This is a pictorial definition of hyperthyroidism and hypothyroidism. This is taken from Davidson. It's a very important pictorial representation of thyroid. So make sure that this goes very well with your theory part. Okay. Then let's go with another question. A 4-year-old child was brought to the department by his parents, complaining of stunned growth. Okay, the key word is stunned growth. On further investigation, intelligence was found less than the normal. So the patient is having lower intelligence with a pot belly appearance. Pot belly appearance is the keyword. So we got three keywords here: stunned growth, the intelligence is less, and we have a pot belly. So these three words should be in your mind. So what is the diagnosis? So let us go into the explanation, then you understand. Cretinism occurs when thyroid deficiency occurred in the first year of life and characterized by mental retardation, marked level of growth, delayed milestones of development, pot belly, protruding tongue, flat nose, dry skin, and sparse hair. So understand that cretinism is the answer. Cretinism should be in your mind when you go the theory part of cretinism should be in your mind, then only you can go with a clarity into the answer. So hypothyroidism, the clinical manifestation of hypothyroidism include cretinism and mixed edema. So here another question from thyroid section, that patient with hyperthyroidism will show increased level of the antibodies. Just to make you understand that antibody section is also very important. Radioactivity, iodine part is also important. The investigation, what type of investigations are shown, the cold noodle, hot noodle, everything is important. The named conditions like Hashimoto's, Graves' disease, such diseases are important. They can jumble up you with questions. So the thyroid and diabetes mellitus part should be very, very thorough with when you're learning the endocrinology. Then the rest part is also very important. You just filter the parts in endocrinology and just filter into another part of like which all parts are important. But hypothyroidism and diabetes mellitus should be in your first line of just answering the learning process. Your first priority should go for diabetes mellitus and thyroid section, then the other section should be also focused. So here thyrotropin receptor antibodies are the antibodies that is increased in hyperparathyroidism. So a patient visits to the OPD with complaints of fever, tachycardia, thyrotoxicosis, mostly what is most likely diagnosis. So here you should understand thyrotoxicosis falls in which condition. Then only you will be very sure. If you go for a wild guess, because every condition is given nearly similar to conditions of thyroid. So here, if you are not very sure that which condition thyrotoxicosis fall into, we get confused. So the answer will go into thyrotoxicosis is hypermetabolic state caused by elevated circulating levels of free T3 and T4, because it is caused commonly by hyperperfusion of thyroid gland. Thyrotoxicosis often is referred to hyperthyroidism. So here ends the today's section, but I want to make very clear that never make your practicing of question very small into just 1 hour or half an hour theory classes taken here. Make it very elaborate. Practice questions every day. Your theory part, I just from looking into your questions, I understand that your theory part should be very clear to answer this precise, simple questions, because they specifically ask the questions. And when we are when we go with the theory in a vague manner, just touch up the manner, touch up the theory and come, it is very difficult to answer such questions. If we are very sure about the cascade, the coagulation cascade, the pathways, the intrinsic pathway, the extrinsic pathway, the factors, the deficiencies, and the named disorders, investigations, everything is very specific for each condition. So they usually ask very tricky questions to confuse you with this answer. So from my knowledge, I think so the tables will be very helpful for you. Just take a note that you make tables and answer your questions from those tables and make thorough with your tables. In endocrinology, when you're going for diabetes and thyroid section, never skip any points. Just go through all the points of diabetes and thyroid. Then you go with the named disorders like another endocrine organs. Pituitary is also an important area. Then adrenal is an important area. So these areas are important. Just look into the repeated questions, the pattern of the questions, and try to answer maximum questions with the time you have. Just go with the theory with simultaneously you go with the practicing of the questions. Then only you get a quick practice of answering the questions, and you get a better clearance of how to answer the question. Otherwise you get panic when you see. I just discuss some of the larger questions. I just put those questions to make you understand. The question seems very large, but the answer is very simple. When you go into the answer keys, the answers are very simple. Just a simple just keyword that will fix the answer. So hope today's class is helpful for you. As I say in all classes, if you need any theoretical explanation from any sections of the classes, any special topics to be taught, any help from our side, we will be very happy to help you. I hope you practice very well with the questions. If you need any furthermore helps in practicing questions, we will be all happy to help you. So that's all for today, and have a good day. Thank you.